Hi, guys, and thanks for tuning in. My name is Dr. Colleen Long. I am a licensed clinical psychologist, and I have worked in the field of weight loss surgery and bariatrics for the last 8 years. I do the psychological evaluations prior to surgery, and I also work with patients postoperatively when they need support. And my goal now is to start to create a line of self-help tools for patients of weight loss surgery so that it can supplement the surgery for them. Because one thing that I'm finding is that people are very excited to have the surgery and they want to rush to get it, and they usually do. And then what happens is about 6 to 8 months after surgery, life starts to settle back in and old behaviors and habits tend to surface, and that's when people tend to have the most problems, and that's when people tend to reach out to me. And for the most part, people are really happy with these surgeries. They are losing weight, they're getting out more, they're isolating less, they're exercising more, they're eating better, and so a lot of the depressive and anxious symptoms that people experienced prior to having the surgery do tend to go away. But there are psychological issues that people maybe don't see as important, or they just don't focus on while in the midst of having the surgery. And so my self-help tools are for you guys that are looking at the psychological piece now, and really wanting to make sure that you maintain weight loss throughout your lifetime. So this first piece is just the intro into my course, my signature course for weight loss on schoolofselfhelp.com. And I'm going to talk about the fundamental shift. So if you hear nothing else from all of the stuff that I give and all the tools that I give, hear this. If you don't make this fundamental shift cognitively, psychologically, regarding food, this too will be another diet. This too will be another form of deprivation where you wait until you can have a cheat day. And if you can make this fundamental shift, there will be no more cheat days, because food is no longer held in the same space. And so what I mean by that is we have to shift the way that we look at food. And we have to look at food as something that provides us sustenance and health and nourishment, and that's it. And for so many people, before they have the surgery, they've associated food with things beyond nourishment, as many of us do. So they've associated food with things like nurturance, relaxation. For moms, it becomes the only justifiable break, a way to demarcate the end of the day, a way to cure boredom, a friend when you feel lonely. A lot of these things are things that we come to associate with food, but the problem is that the more associations we have, the deeper the attachment that we have to food. And so the goal is to really put food in that only one place that we need it, which is for nourishment. I had a lady once, she came in, and she's been sober for 20 years. She was able to rid herself of her alcohol addiction, but not her food addiction. And she started going to OA groups, and she said that one of the leaders there said, with alcohol, you slay the dragon. With food, you have to take the dragon out for a walk 3 times a day. And it's true. We do. We have to still deal with food 3 times a day at least, even after these surgeries. And so the way that we get through that is by holding food in a different place. We shift the way that we look at food so that food is just where we get nourishment, just like brushing our teeth. So we wake up, we brush our teeth. We don't think about what kind of toothpaste am I going to use and where am I going to brush my teeth and who am I going to brush my teeth with. We just brush our teeth and we get on with our day, right? Because we want healthy gums. And so that's sort of the way that we need to look at food. We prep our meals on Sunday, and that is the most we think about it. And then we automate. We get up, we have our protein muffin, we have our frittata muffin, whatever it is that you're doing for your breakfast. And that's the extent of it. And it may not be yummy and creamy and cheesy and bready and carby, but it's food and it's nourishment. And so we shift our view of what's quality and what's good in life to the things that are good in life, right? So we shift to not needing an extra a seat buckle extender on an airplane. We shifted to being able to ride the amusement rides with our kids. We shifted to being able to keep up with our kids and our grandkids. being able to buy a new dress, getting a compliment from a friend, planning a vacation. All of these things start to take and define quality of life. And no longer is food the place that we look toward for comfort, quality, relaxation, all that stuff. We have to find these sort of alternative ways of getting the benefits that we did before. And I'll talk about that more. If you guys want more self-help tips, feel free to visit schoolofselfhelp.com. You can subscribe and I'll send you some free weight loss tips. I'll send you my free mini course as well. And feel free to check out any of my other videos all related to weight loss surgery. And if you are in the midst of this, I hope you're doing well. And if you're getting ready to do it, good luck.